All right, guys, I'm going to hit start webinar and we are going to let the attendees in. Great. Hello, everyone. I'm just going to give it a few seconds for folks to enter into the room. The floodgates have opened on the waiting room, so it's just going to take a few seconds to get a good chunk of folks in. So if you want to give us just 30 seconds, and then we're going to get started with today's content. Thank you so much for joining us. All right, the flow is slowed down a little bit. So I'm going to go ahead and get us started. And I'm really excited to kick off today's conversation. So good afternoon, everybody, and welcome again to today's webinar, Looking Back 5 Years of Family First Prevention Services Act. I'm Meg Dygert, Senior Policy Associate at the American Public Human Services Association, and I lead our portfolio of child welfare and family well-being work, which primarily means working with our National Association of Public Child Welfare administrators, otherwise known as NAPCWA, because we love a good acronym in this field. I'm very excited to welcome you all today. I'm just going to start with a few logistics. I will be your MC today, moving us throughout the agenda. I will do my best, Ryan Seacrest, for today, and move us along and keep us on pace so that we can hear to everybody and hopefully have some time for discussion. All participants are muted and off camera. We do encourage you to use the chat to enter any thoughts, and to also use the Q&A feature to submit questions for today's speaker. Please note all speakers will be welcome to participate in today's chat. Associate Commissioner Schomburg will not be participating in the Q&A, so just when you're submitting questions, keep that in mind. We will likely not have time for many questions, but we will use questions submitted to inform future webinars and for follow-up information. So we really encourage you to add your thoughts and to submit those questions. The webinar is being recorded, and follow-up materials and resources that are going to be mentioned by today's speakers will be shared with the recording to all those who are registered for the webinar. With that, I'm going to turn it over to my colleague, Matt Lyons, to start today's conversation. Thank you. And Matt, take it away.
Thank you, Meg, and good afternoon or good morning, everyone, depending on where you are. And just on behalf of the American Public Human Services Association and all of our state and local members from human services agencies around the country, just want to extend a warm welcome to all of you for joining us for today's webinar, where we are going to recognize and explore the work that we've accomplished and all the work that remains at the 5-year anniversary of the Family First Prevention Services Act. I want to give a special thanks to our partners at Prevent Child Abuse America, and certainly to my colleague Meg for pulling together this conversation, which I just think is so incredibly important in shifting our work towards prevention and narrowing the front door to foster care. Since Family First passed in 2018, I think we all know that the law has been just fundamental in efforts to accelerate a shift in the structural, the relational, and all the transformational changes to how we are envisioning and actualizing a child welfare system that is oriented towards keeping families together and supporting kids that are in foster care in the least restrictive setting. But as we do the work, it's clear that we have many miles to go. If we are going to disentangle decades of policies that have led to over-surveillance in the child welfare system and contributed to structural inequities for communities of color, it's going to require wholesale transformation in how we design not just our child welfare system, but also all of our upstream systems that work in support of keeping kids safely together and are part of the solution. As we do this work, we know we are grappling with very real challenges in how we stretch Family First as a prevention tool that is reflective of what communities tell us they need, and how we build the alternate pathways and supports that kids and families need and want. So for today and our forthcoming webinars in this series, we invite you to unpack with us and all of our esteemed speakers today the many levers that we need to pull to truly realize the vision of Family First, and encourage you to stick with us through these conversations and all the work in between. I am excited for today and what's to come, and very happy to turn it over to my colleague, Dr. Melissa Merrick from Prevent Child Abuse America, to share some welcoming words as well.
Thanks, Matt. We are so happy to welcome you all as well to this conversation that I'm really looking forward to. You know, I think looking back at 5 years of Family First is just pivotal to really embrace our prevention goals. And what are our goals for children and families? We want children and families to have what they need when they need it in their communities, without stigma, with a lot of love, right, before they find themselves in crisis. And so as the president and CEO of our nation's oldest and largest organization dedicated to the prevention of child abuse and neglect, so the primary prevention, we really are excited about Family First being one tool in a comprehensive array of supports and services and opportunities that can really strengthen families. I just want to welcome all of the Prevent Child Abuse America Connected Network and APHSA folks to this conversation. I think, you know, we know that prevention can only happen in partnership, and it requires a partnership with APHSA, with the Children's Bureau, with families and family voice at the center of this work, as my colleague Matt shared, to really transform and imagine what's possible, right? To move from adversity to possibility. What can we do now and often to support families and strengthen them? And I think that's why we're all here, over 158 people right now. I'm just really excited to have you all here and excited for the conversation. So prevention is possible when we come together in these ways. So with that, I will pass it over to Meg.
Thank you, Dr. Merrick, and thank you, Matt, for kicking us off and offering such great welcome remarks to really set the tone for today's conversation. I'm now going to invite Aisha E. Schomburg, Associate Commissioner of the Children's Bureau within the Administration of Children and Families, to offer remarks as well. Aisha?
Thank you, Meg, and it's really good to see you both, Matt and Melissa. Good afternoon, everybody. I'm Aisha Schomburg, the Associate Commissioner of the Children's Bureau. Thanks, of course, to APHSA for inviting me to participate in the celebration and to offer a few Family First updates. You know, at the Children's Bureau, we will never give up on children and families who need support, and we have our attention on 5 main principles. Consistent with this administration's executive orders, equity is the overarching focus. Child abuse and neglect prevention, supporting kinship caregivers, supporting older youth in foster care who will transition out of care, and supporting the child welfare workforce. Now, the lived experience and voices of young people, parents, and professionals are paramount to how we do our work and how we establish our goals. As you all know, Family First was signed into law on February 9th, 2018, so we're literally 2 days away from the 5th anniversary. Family First is a once-in-a-generation opportunity to change the way we think of child welfare by shifting the focus and putting money toward preventing children from coming into care. It's really simple. Let's prioritize spending in a way that keeps families together. It was grown out of a bipartisan vision to shift the child welfare focus to prevention services that can increase the number of children who remain safely at home with their families by providing the families with greater access to what they need: mental health services, substance use treatment, in-home parenting, and other interventions tailored to community needs. Now, ACF and CB view Family First as revolutionary in terms of shifting focus and funding to prevention, but equally important, reducing over-reliance on congregate care placements and to be intentional about placing children in the specific types of programs that can best support them. So here's what we've been doing: encouraging all states to submit prevention plans and approving those plans that promote designs that increase equity, shift to a prevention focus, and adopt a family-centered approach, including supporting kinship caregivers. Provide more tools that can help tribes apply for their own plans and support collaboration between states, courts, and tribes. And we keep working with our colleagues in OPRE to make the Prevention Services Clearinghouse more culturally competent for all of the families we serve in all of the jurisdictions. And very soon, we will issue written guidance that provides information about prevention plans that have already been submitted and approved, and also clarifies policy questions about the Title IV-E prevention program. And here's what we have planned for what we're calling a phase 2. We want to support the implementation of those approved plans. We want to evaluate data and highlight key data to identify best practices and opportunities and to share those best practices. We want to support agencies as they begin to submit their new 5-year plans. And we continue to work towards ensuring that prevention programs that are clearinghouse rated are culturally relevant for all communities, including communities of color and tribal communities. And we want to serve families by providing economic and social supports on the front end, including to kinship providers. So what is the status of prevention plans today? In October, we really doubled down on our work with jurisdictions to provide individualized technical and administrative support for submitting prevention plans. This was an all hands on deck approach with everyone from regional specialists and regional program managers, myself and our assistant secretary, reaching out to offer support, to understand and manage jurisdictions' challenges and knock down barriers that were inhibiting submitting plans. This approach has worked wonderfully. As of January 7, 2023, we are thrilled to report that the CB has approved 39 prevention plans from 35 states, 3 tribes, and the District of Columbia. We remain in consistent communication with jurisdictions that are preparing or amending plans. We are in the process of reviewing about 11 plans that have been submitted recently, as well as working with jurisdictions who are amending their plans as they drill down on how they want to implement their prevention programs. Of the evidence-based programs and approved prevention plans, 76% are well supported, 31% are supported, and 16% are promising based on the ratings of the Title IV-E Prevention Services Clearinghouse. We've also been in touch with several jurisdictions whose plans include innovative approaches to prevention, and we're excited to be sharing some of those approaches in the coming weeks in the upcoming guidance. Of course, we're providing robust technical assistance, and for tribal 4E agencies, we're providing additional support for tribes that have agreements with states to operate prevention plans. Now, we look forward to our continued partnership with jurisdictions and, of course, with APHSA to provide comprehensive prevention and other supports to children and the families that we serve. Thank you so much for having me.
Thank you, Associate Commissioner Schomburg. Appreciate your leadership and time and the partnership from the Children's Bureau as we work to advance and implement Family First. I'm now going to turn it over to Jennifer Jones from Prevent Child Abuse America, who's been key in organizing and pulling this webinar together. So thank you, Jennifer, for all your help. And she's going to kick off the panel today, as well as introduce our first round of speakers on today's panel. So Jennifer, take it away.
Great. Thank you. Thank you, Meg. And hello, my name is Jennifer Jones, and I'm the Chief Strategy Officer here at Prevent Child Abuse America. It's such an honor and so great to be here with all of you today and to be partners with APHSA on this webinar series. I have the distinct honor and pleasure of facilitating today's discussion with our esteemed panel. Before I get started, I do want to say thank you so much to Meg and to APHSA and to all the folks that helped organize this FFPSA webinar series. Again, we're just honored to be partners with you in this series. I also want to say thank you to Associate Commissioner Asia Schomburg for being here with us today, for sharing the vision and the intent of Family First, and for providing the updates on the prevention plans, and more importantly, Associate Commissioner, for your commitment to equity, for your commitment to people with lived experience, and for all the amazing work that you have done so far in your tenure. We felt that it was important to start off this webinar today by really grounding ourselves in the intent of Family First. As we all know, it's been 5 years since the legislation passed. And now we want to move into a conversation with our esteemed panelists who will help us really reflect on the last 5 years of Family First and share their perspectives on where do we go from here together as partners in prevention and in child welfare. So we are incredibly honored to be joined by, I'm going to just share a little bit about each one of our panelists, and then we will go into specific questions. So I'm going to start with Heather Baker. She's the manager at the Public Consulting Group, and Heather leads PCG's Child and Family Services practice. She and her team work with state and local agencies across the country who provide child welfare, child care, early childhood, juvenile justice, and children's behavioral health services. Heather and her team have worked with 19 states to support implementation of the Family First Prevention Services Act, combining program and policy analysis, evaluation, and continuous quality improvement, and fiscal expertise to really help states work with the communities as they implement this law. Next, we have Jamie Kramer. Jamie is the administrator at Nebraska's Division of Children and Family Services at the Nebraska Department of Health and Human Services. Throughout her 12-year career, Jamie has had the opportunity to work within many facets of the child welfare system in the Nebraska Department of Health and Human Services. She began her career as a frontline caseworker, and she served as a caseworker supervisor leading up to her current role as administrator. She has been in her role since 2018, and she's focusing on statewide programs and services and policies and procedures related to case management and many other things. But also this includes FFPSA implementation and its evidence-based programs. Dr. Jerry Milner is the former Associate Commissioner at the Children's Bureau and currently the co-founder and director of the Family Justice Group. Most of you know Jerry as the former Associate Commissioner at the Children's Bureau. He also served as the Vice President for Child Welfare Practice at the Center for the Support of Families, where he assisted state and local child welfare agencies in evaluating their child welfare programs and designed and implemented improvements in practice, policy, and procedures. Jerry has been a fierce advocate for people with lived experience, for equity, and for transforming and reforming our child welfare system. So thank you all for joining us today. We are so incredibly excited to hear from each one of you. So I'm going to start our conversation this afternoon by having each of you briefly reflect on the first 5 years of Family First implementation, how you think it has impacted the child welfare field, and in particular, how it has impacted prevention in the child welfare field. So I'm going to turn it over. Is Heather and Jamie on? Thank you so much, Heather. We'll have Heather go first and then Jamie.
Thanks, Jennifer, and thank you to Meg and Lynn and others who have organized this event. Yeah, reflecting on the 5 years of Family First implementation is really just thinking about the enormous amount of work that state and communities and partners have put into what has been a huge amount of planning and implementation for this really complicated law. I think most notably, prior to Family First, there was a general recognition across the child welfare field, and particularly on the state administration side where I do most of my work, that there was a deep need to move services upstream and into prevention of child abuse and neglect, first and foremost, and then prevention of placement into foster care. But the lack of funding from the federal government made it difficult to get those investments from state legislatures and other funders. And so certainly introducing a federal funder into prevention services in a new way shifted the conversation, both because of pressure, good pressure from community-based agencies, families, and family advocates, as well as legislatures and places like Governor's Budget's Office, who learn that there is new federal funding for these kinds of services. And that gave rise to a huge amount of emphasis in national conversations. I have participated with a lot of you in various collaboratives and forums to talk about the challenges of implementation and to plan for expanding services. A lot of states that we've worked with had robust prevention services array going into Family First. And that allowed some of those jurisdictions really quickly apply for, submit their prevention services plan and get approval and begin to work on the mechanics of how to get your financing operation working and your reporting and claiming to begin to access those new federal funds. But a lot of states, even those that had robust prevention service arrays or states that relied on other government partners like Medicaid and early childhood, NAPCWA or TANF to fund some of those prevention services, really had to take a lot of time to plan for how they would transform the way that they do child welfare to engage more directly with those services. And so we've seen also at the same time the continued challenge of substance use disorder across the country, the occurrence of COVID in the middle of this, giving us a lot of attention towards the kinds of mental health supports that all parents need, and particularly some of our parents that are experiencing crisis and engaging with the child welfare system. And so I think the array of connections that child welfare agencies have been able to make across those funding sources, connections with early childhood home visiting programs, connections with Medicaid agencies that are funding substance use disorder treatment have accelerated because of Family First.
Great. Thanks so much, Heather, for sharing that with us. I'm going to actually turn it over to Jamie next and if you need me, Jamie, to reread the question, I can certainly do that. No, good. All right. Good. Thanks. Awesome.
Yes. Hi, good afternoon. I'm Jamie Kramer. I am the administrator here in Nebraska who's tasked with implementing FFPSA. So to, I guess, answer quickly to the question as far as how it's impacted our child welfare system, specifically to Nebraska, obviously this is not an overnight implementation. I think we were all kind of in a position back in 2018 that it sounded good, it looked good on paper, but how are we going to implement and how are we going to bring people to the table? So it's been a little bit of a struggle and a heavy lift, but I think, you know, as we continue our work and efforts towards prevention, it's really increased our collaboration with others in our community and across the state. Throughout this, it's also helped us to recognize just how important and vital it is to elevate the voice of lived expertise. I think without that as being part of the implementation, our implementation won't work. That lived expertise is going to drive us and inform us as to how we implement FFPSA and what within FFPSA we will implement. But we are also able to come together to have a shared vision of what this should look like in us moving more towards the upstream towards community prevention. And so we created a steering committee that is really tasked with transforming our system into what we call a well-being system. So it's really focusing on the child and the family and the well-being of the family unit. In an effort to really ensure that they stay together and that the family unit is preserved. The last 5 years has also helped us to recognize again the lifting of the lived experience voice. And so Nebraska did create a new team called the Family Advocacy Unit. They are created or established with those with lived expertise. And the goal of this is to improve the family's experience of the system, and not just child welfare, but any other system they might be working with, such as, you know, economic assistance, child support, Medicaid, etc. I will add that we were one of the early adopters of FFPSA, so we were very fortunate to have our plan approved, I believe back in early 2021. So it's really established that groundwork of moving forward with prevention services and what prevention services we want. The last 5 years has also helped to strengthen our cross-systems relationships. So not just within child welfare, but across the whole board. This includes our judiciary partners, community stakeholders, those with lived expertise, etc. Just so there's really a common understanding and goal of how important it is to have prevention in place and to work towards that well-being. One thing too that we were fortunate was that we already had Healthy Families America implemented in Nebraska. It just wasn't in child welfare. So through FFPSA in the last 5 years, this afforded us the opportunity to expand Healthy Families America into the realm of child welfare to further assist families that were in need of those supportive services. And so we've seen a variety or wealth of families come through that are doing the child welfare protocol of HFA. And so we hope to expand and continue to build capacity for that program. From a state legislative level, there has been some recognition of prevention, fortunately. In 2022, they passed a bill that is to really look at transforming its child welfare system comprehensively. And so it's doing a deep dive review and analysis of what Nebraska's child welfare model looks like now, along with its finance model, and where it needs to go to make prevention an overarching thing, but also to making it successful here in Nebraska. And then lastly, one big thing, of course, that we learned that we knew coming in, but it's really solidified that is just how important it is to have trauma-informed programs and keeping these families together and actually taking a real deep dive into the dynamics within the family and what has possibly led up to the current situation instead of just trying to put a Band-Aid on it. And so that has afforded us a great opportunity to be more intentional about the work that we do and the services that we provide.
Great, Jamie, thank you so much. There is so much there that I would love to unpack. But obviously the time it limits us in doing that. Also, just want to acknowledge Healthy Families America. That's obviously a Prevent Child Abuse America's signature home visiting program. So we love that you are doing that work in Nebraska as well as others across the country. So thank you so much, Jamie, for sharing that. I'm gonna go back to Heather. And the second question that we have here for each of you is what do you see, what do each of you see as the biggest challenge that the field is continuing to face as we work to implement family first prevention services, and certainly as we work across the country to build an array of prevention services in a prevention vision, not only in our communities, but across this country?
Yeah,
So
thank
Heather,
you. Yeah. Okay, this is a question that I could answer. What are the challenges for a very long time? But to narrow down my list of some of the challenges, I think one of the biggest one is just in understanding the law to begin with. There is an internal inconsistency in this law that so many states have been struggling with. And that inconsistency is that in order to receive a family first prevention service or a service that's being funded through the Title IV prevention program, a child has to be identified by the Child Welfare Agency as at imminent risk for removal from the home. And this phrase, imminent risk, is not further defined in the law, and the Children's Bureau and their policy program instructions have given states the ability to define what it means to be at imminent risk for removal from the home. The challenge with that is that we have so much information now about the pluses and minuses, or the challenges associated with assessing risk in child welfare. And the concept even of an imminent risk is one that I personally find really hard to understand. Risk is by nature unpredictable. And regardless of the actuarial soundness of our risk models, and even our most tenured and experienced child welfare workforce, which unfortunately right now, very few families have access to an extremely tenured and well-trained caseworker. We're in a casework crisis right now. But even if both of those two things were perfect, we would never be able to predict risk well enough to categorize a risk as imminent. High-risk cases can go on with relatively good outcomes. Very low-risk cases can experience catastrophic results. So just the concept of imminent risk is problematic to begin with. And then the law goes on to say that the services that can be funded by Title III Prevention Services Program can be evidence-based practices that have proven to be effective to reduce child abuse and neglect and reduce foster care placement. And so the kinds of services that 4E will pay for can be services that prevent child abuse and neglect far before a risk of removal from the home is at hand, or the way that most of us would understand imminent. So in that way, the law contradicts itself. Now that gives us a big opportunity to really work closely with federal partners to make definitions in prevention services plans that match more with services that are approved on the clearinghouse and the intended recipients of those services, and sort of less with this phrase in the law that I have come to conclude is kind of a nonsense phrase, imminent risk, that we can work with federal partners to kind of try to align those things so that they make a little bit more sense. But I think that has been one of the most significant challenges in implementing the law.
Great. Thanks so much, Heather, for sharing that. And just want to plug that one of the webinars that we will be doing on FFPSA is around policy. So certainly interested in exploring a little bit more there, Heather, that you shared, as well as other things that we can do to enhance the intent and the impact of Family First, and in particular, prevention of child abuse and neglect. So Jamie, what do you see as the biggest challenge in the field as we implement FFPSA?
So I'll echo a lot of what Heather has just reported out. I think all states that we're working to implement, face similar challenges. I know the definition of imminent risk was one of those at the top of the list that we just didn't understand how we could be the ones responsible for making a definition for that. And so we've been able to draft something. We don't know if it's, the right definition, but we're working with it. But yes, that was one of the biggest challenges. I will say, though, specific to Nebraska, a big challenge has really been that buy-in and that culture shift within not only child welfare, but the entirety of our system and state. Nobody likes change, but prevention and child welfare, it's really a radical change to our system. And so it does take a lot of time to change that focus, to move it more towards that prevention arena and getting away from intervention or punitive measures. And so it's really trying to transform that mindset. That's been a large challenge. Also, the availability or access to equitable services. We've got a state that a majority of it is really in rural frontier country of Nebraska. But we also have large populations of underrepresented folks. And so having those services to culturally meet their needs is very, very limited. Also with that, we have fewer providers in our rural areas. I'll emphasize licensed mental health providers, for example, typically don't want to go to the rural areas to conduct their practice. They want to be more in the urban areas. So it has been a struggle to try to find those mental health practitioners, but also to keep them in those rural areas to continue to provide the service. But also for providers, it's been the cost and availability of funding for them to not only implement the program, but to sustain the programs. As we found, these programs are very, very, very expensive, along with the training that they are required to go through. And so it's trying to navigate what we have available to us to try to bring up providers to help implement and build capacity of those services, but the funding just really isn't there.
Great. Thank you so much, Jamie, for sharing that. And hopefully, again, get to dig in a little bit more into some of the challenges and what's happening as well in other parts of the country. Unfortunately, Jerry Milner, Dr. Milner, wasn't able to join us last minute, so we apologize for that. But we are flexible and we'll go with the flow here. And so we now have a couple of questions, separate questions for each of the panelists. And so Jamie, I'm going to actually start with you. So I'm going to go back to you and want to hear from you about what do you think is the most promising in terms of how Nebraska has leveraged Family First to align your prevention supports, and in particular, if you can talk about HFA. I know there was a question in the chat, and so aligning prevention supports and keeping more families together.
Yeah, so when FFPSA passed and became law back in 2018, Nebraska was in a unique position where we had already been building up our prevention infrastructure for the prior several years. So we had somewhat of a foundation to build upon, but to expand that or bring that over into child welfare. And so we were able to implement a case management tool or practice of alternative response, which has helped us to really work with those families that might be more or less at risk, but to help them access the appropriate services. And then we also have the Bring Up Nebraska program. And so that is done through our partners with the Nebraska Children's Families Foundation. They have actually what we call a community well-being model. And so it recognizes that really all individuals and families, we all face challenges. And so if the communities are there to provide that added support at the onset rather than later when there might be a crisis, this could really improve the outcomes for children, the adults in their lives, and also the communities as a whole. And so we really rely upon those communities to help our families work towards finding those community supports, but really making our communities and families the decision makers as to what the transformation is going to look like and continue to look like within Nebraska. We've also, it's provided us a support or an opportunity, I guess, to align with other prevention supports with the creation of the Nebraska Child and Family Wellbeing Transformation Committee. And so what this is a strong cross-system partnership that has a lot of stakeholders at the table. It does include those with lived expertise, but the common theme with them too is that they are all committed to creating a child and family well-being system that's really oriented around the prevention of maltreatment while promoting child and family well-being. And so this was established back in 2020, and this was done through partnership with the capacity building for states as well. We've also been able to look at the analysis of our child welfare practice model. And so in 2022, our state legislature actually passed a law looking to really dive in deeply into what our model is in that finance model, but it's also including the 3 branches of government. And so the goal of this at the end of the day is that we will have a framework proposed that will help us to establish a more intersectoral child welfare practice and model in Nebraska, and something that's not just siloed to our area or our division. And then also we've, being innovative, thinking outside the box, there's really that focus of how can we move upstream with FFPSA. We're really in that secondary prevention phase right now, but I mean, the ultimate goal is to prevent families from even coming to our attention. And so we have just now started a pilot with families going through HFA, that if they choose to continue participation in HFA after their child welfare case closes, they can continue with that service, no interruption in it. We will be basically the one to hold on to that prevention plan and pay or continue that referral for continuance in that service. So we intend to do this pilot, I believe, over the course of 12 months, just to see the recurrence of families coming back into the system, even after continued participation in HFA, or no recurrence. And so I think really inform us as to what direction we're going with prevention. As I mentioned earlier, we also have the formation of that family advocacy unit. And so that has been really a big lift to help get voices of lived expertise at the table to help us leverage FFPSA and identifying what the needs are in Nebraska. And then lastly, we also partnered with Chapin Hall to conduct a formal gaps needs analysis. And so they did an entire analysis and scan in Nebraska back in 2021 to better understand what programs would be specifically applicable to Nebraskans, and then provided us with recommendations. And that is really centered on building up a prevention service array that is more accessible and more equitable to our families.
Thank you so much, Jamie. Again, I'm just, it's so amazing to hear all the incredible work that you're doing there in Nebraska, especially around prevention. We obviously are big fans of primary prevention. That's where we focus all of our work on. And so it's so great to hear that you're thinking about that as you explore further prevention supports and services for kids and families in Nebraska. Dr. Milner, Jerry, so good to see you. Thanks so much for joining us. And we appreciate you making the time and are very excited that you're here and certainly very interested in hearing more from you. So I'm going to actually go to you, Jerry. And we had a couple of questions that we asked Heather and Jamie. And so I'd like to ask you those questions if that's okay with you. So the first one is we would love for you to reflect on the first 5 years of Family First implementation. Really interested in hearing how you believe it has impacted the field, the child welfare field as a whole, but in particular, in its relationship to prevention. So how it's impacted child welfare's vision and view of prevention services and work in this country.
Yeah. Thanks so much. And let me say, I actually thought I was calling in early for this meeting because the message said 2 o'clock, and I just now figured out that meant 2 o'clock Eastern time instead of 2 o'clock Central time, where I am right now. So to everyone, I deeply apologize for being tardy here. That was not my intent. I can start out by saying, I think when I tend to call it FFPSA, I'll try to stick with Family First here, but when Family First passed, much to our surprise, actually, in the Children's Bureau, there were a few things that worried us quite a bit about it. And I think one was that even with Family First, we're still trying to fix the trauma rather than actually trying to prevent it. That has been and remains for me a core concern. I think, and I don't have benefit of what everybody else has been saying up to this point, but I gathered that Jamie, and by the way, Jamie, I'm sitting in Nebraska here today too. So I gathered Jamie was talking a bit about primary prevention, and I can't skirt the issue that I think that's where prevention must start. Any place we need a full range of continuum of prevention services, but and Family First provides it at one specific point in time, and that's when the child is at imminent risk of entering foster care. And I think that I worried that we should not allow children to get to that point and then try to fix what's happened. And then the third area that I have worried about, it's not prevention related, but it's how to go to almost no congregate care in a very short period of time by creating new ways of serving the children and families that are out there. I think it's been great over these past 5 years that we've been able to use Title 40 dollars for something other than paying other people to take care of families' children, which is all that it's been, and that's the largest part of money that we have in child welfare. But I continue to be worried about the fact that we're not beginning early enough. And I realize Family First was never intended to be a primary prevention tool for the states, but I think one of the big worries that I have had all along, continue to have, is that we're still, maybe even more so than we were prior to Family First, literally stuck on trying to find more and more clinical interventions out there to try to address trauma that we absolutely could prevent if we had a more expansive approach. And for that reason, the word game changer has been used an awful lot to describe Family First. I have never used it except to say I don't think that in the sense that I'm looking at prevention, that it has actually followed that kind of a pattern. And I don't think, while I've always said I thought Family First was a good step in the right direction, I don't think we are yet at the point where real primary prevention is our major tool of choice out there. There are other things that I could reflect on there, but I think those would be some of the major points that I'd want to make.
And Jerry, really appreciate that. And one of the reasons we really wanted you to join us in this conversation, and hopefully you will come back and join us in future webinars about FFPSA and all the leadership that you've provided in this country around prevention, in particular in primary prevention. One other question that we're interested in hearing from you about as well is, what do you see as one of the biggest challenges in the field as we continue to implement Family First and build this sort of broader array of prevention services, including really moving more upstream to primary prevention?
Yeah. I'll answer that in one word: the clearinghouse. I think that the clearinghouse has been a real source of frustration for an awful lot of states. It's been a source of frustration for me. I think it's a very slow, cumbersome, and frankly, completely unnecessary process. We already have evidence-based clearinghouses that are out there, and why we needed to create a new clearinghouse, which ends up being a new little bureaucracy, mini bureaucracy on its own, has been something that has perplexed me for quite some time. I think another challenge, and also I just was gleaning a little bit from what I think Jamie was saying, is that I think there was a tremendous opportunity here to use the prevention plans in Family First to think much more expansively about what prevention looks like, and how if we're going to bring people together and we're going to explore these things, I think we should go in a much broader way. But quite honestly, the detail, the prescriptiveness of Family First for prevention plans in my opinion, state folks may totally disagree with me, and I will defer to people who are actually involved in those plans. But in my view, it discourages innovation. I think it discourages doing much of anything other than just what the law requires. Having been in the federal government for a while, I know that that's what folks will be looking for in terms of approving plans. Does it meet what the law requires? Even though I think the opportunity has been there, and I think the law provides for a much more expansive interpretation of those plans, I think is not being fully taken advantage of. Another huge challenge that I hear from states an awful lot on is absolutely just the cost of bringing up new evidence-based practices and the cost of operating those with fidelity, retraining the staff, developing continuous quality improvement processes. In that respect, I don't know if I should say this or not, but I think it's much more geared toward purveyors than it really is towards improving the lot of families out there. So those are some of the challenges that I'll mention.
Thank you, Jerry. And I'm going to come back to you in a minute. I do want to go to Heather. And interesting how you talked about innovation and how it may be limiting and prohibiting innovation. We're interested, Heather, in hearing from you. You've been working really closely with many states. I think we saw 19 or so in your bio as they implement FFPSA. And so really curious to hear from you if you're seeing any promising trends or innovations that you think are really helping FFPSA achieve its intended vision.
Yeah, thank you. I definitely think that motivational interviewing falls in that category, but I'll get back to that in just a second, because I heard things that Jerry said and Jamie say also, where I think one of the places that Family First has shown, maybe shown some light, is in its narrowness. In other words, Family First is not going to be in and of itself an effective prevention strategy or solution. And in states particularly where there are rural areas or small community areas or communities that have very specific needs within their population, there is a temptation at the state level, and particularly if you're dealing with funders. I used to work in the governor's budget office, I know the way that budget people think, to privilege the kinds of services that receive federal reimbursement, and to really only want to talk about expanding the kinds of services that are eligible for funding under Family First. And I think that's a big mistake. And where we have seen some really interesting innovation happen is in these smaller communities or rural communities that have built their own model to meet the needs of the families that they're serving in those communities. And those services may never become large enough or specific enough or have a large enough population to have the kind of evaluation that Family First requires. They may never see the clearinghouse or a single federal dollar coming from Family First. But that should not be a reason for states to not make investments in those programs. We have to really look, and I mean both far upstream prevention of child abuse and neglect, but also even those programs that are really focused on preventing placement into foster care for the children who are experiencing the foster care system now. So that's one thing that I would just urge that, and I think that it's happening where those kinds of programs are getting additional attention as they work with their own legislators and work with their state oversight agencies to make the case for funding and for ways in which their outcomes can be measured and be demonstrated to be effective without having to go through the rigorous evaluation. So that's one thing. And then I don't want to take up too much time, but motivational interviewing is, I think, a really promising and exciting practice that's being expanded. It has a lot of flexibility and a bit of a looser manual, and the way that people talk about it, to say that it is not something that you do, but a way that you do something. I think the promise of motivational interviewing being embedded in case practice is that it turns our case workers into active listeners, to listening to the experiences of the people that are living it right now, the people whose cases that they are serving, shifting that relationship to one of listening, of allowing the participant to talk about what they are afraid of, what they're ambivalent about, and over time move towards change, is a really different kind of model for casework. And I am enthusiastic about that in the context of Family First.
Yeah.
Great, thank you so much, Heather. I'm going to go back to Jerry. Jerry, Associate Commissioner Schomburg, Jamie, both mentioned equity and equitable access to services and supports. What do you think we should and can be doing better to promote equity in the context of Family First implementation?
Yeah, there are a few things there. Again, when this piece of legislation passed, I think two big thoughts were occurring to us, which was, will it specifically address the needs of the two most overrepresented groups of children and families in the child welfare system: Black families and children, Indigenous families and children. The second big worry is, would we have flexibility for tribes, who many of whom have cultural traditional beliefs that are in conflict with our regular child welfare system. And I think that, to some extent, we've been able to deal with a bit of the tribal issue. I'd like to say how I think it still falls short of creating equity there. But one of the biggest worries I have is that, number one, the federal government prescribes what families need by saying you can only pay for mental health services, substance use treatment services, and by the way, you must be a bad parent, so we'll pay for you to build up your skills for parenting here, at the expense of what communities know and families know that they need to alleviate their issues, their concerns, the barriers they have to being able to thrive. I think that's an impediment to equity at virtually every level. And when we talk about equity, I just want to be clear. I'm not talking about trying to get the percentage of Black children in foster care to match the percentage of Black children in the general population. We may not need that many Black children in foster care at all. I'm talking about equity in terms of being able to access the kinds of supports that family needs in the community that they live in, and to be able not to be limited by saying you can only get mental health, you can only get substance use treatment. I think that in essence promotes inequity if it does anything at all. We have to make sure that the offerings that we make out there have their evidence in serving the two most overrepresented groups of kids, Black children and Indigenous children. And I don't think that that's the case with most, or I would guess very few of the services that are actually in the clearinghouse. And yet that's what we continue to offer. And I don't know that I don't feel like in any way that's promoting equity and equal access. The final thing I'll say is related to equity with regard to tribes. We did have a bit of flexibility there for 4E tribes that receive the money directly to not have to comply with all of the requirements for services. But that's a small number of the tribes out there that need help. We had encouraged and promoted legislation that would extend that flexibility to the much larger group of Title IV-B tribes out there, so that we can respect the cultures and traditions there. If we could get to that point, I think we would be in a much more equitable position with regard to the tribes.
Thank you so much, Jerry. I really appreciate your comment around the federal government sort of prescribing the services that that communities can access. And in particular, we know that economic and concrete supports aren't one of them, but there's certainly plenty of research in the field that shows the impact that economic and concrete supports have on the prevention of child maltreatment and child abuse and neglect. I want to say thank you to all of our panelists, Heather, Jamie, Jerry. Thank you so much for sharing your insights, your wisdom. We really value that. Thank you for being here with us today. And now I'm going to turn it back over to Meg. We have a couple of respondents that are going to share their thoughts based on what they just heard from the panel. So Meg, back to you.
Thank you, Jennifer, and thank you again to all of our panelists for that thoughtful conversation. And we could not think of a better way to include some additional voices key in this conversation than to invite these two next speakers to offer some of their reflections from their perspective. Next, we're going to invite Sheila Poole, who's the former commissioner of New York State's Office of Children and Family Services and currently serves as vice president of external relations here at APHSA. So I'm lucky to also call her a colleague now. And then we will hear from Sixto Cancel, who's the founder and CEO of Think of Us. So we're going to start with Sheila. I'm going to turn it over to you.
Great. Thank you, Meg. And it's wonderful to be here listening and learning on our Family First journey. Jerry, it's great to see you. It's been a while.
Sheila, good to see you.
Yeah, this is terrific. So, you know, in New York, and I want to absolutely recognize my former colleagues in New York. I see Lisa Gartia-Ogundimu, who's our Deputy Commissioner for Child Welfare, who led a lot of this work. You know, I'll just start at the beginning when, you know, Family First was first contemplated. We in New York, you know, we're very vocal in expressing some of our concerns regarding what felt, right, like really limitations and sort of missing the entire point of finally allowing our child welfare system to really get way upstream. But of course, we know the bill passed. It is what it is. And you know, there is a lot to be said. And you'll hear about this, I think, in future webinars on the congregate care side and senses of urgency that it really brought in other parts of the system. But with respect to our focus in New York and our deep desire to you know, one way or the other, finally drive a true upstream prevention program, we really came to understand and believe and really shifted our focus to using Family First and the 4E reimbursement and the federal plan as our floor, not our ceiling of our aspirational upstream prevention plan. And once we decided that we were going to write our plan, construct our plan with stakeholder involvement, you know, with less of an eye toward tapping into 4E dollars because of many of the limitations that have been shared already, it really brought a remarkable sense of focus and intention to myself and our team in thinking about creative ways that we were one way or the other going to drive upstream prevention. And so we went about our plan a little bit differently, I think, than some other states did. We were not one of the first to submit our plan. I think we were, you know, sort of middle of the pack, but it gave us a lot of time to engage with stakeholders. I think there were about 400 different stakeholders we had engaged with, and of course, many of parents and kinship caregivers and young people experiencing our system. And frankly, what our prevention plan really looks more like is an upstream prevention plan and tapping into strategically 4E and some models in the clearinghouse that might help us do that. And so our, prevention journey in New York was also looking at not just 4E, but what other child welfare funding streams were in front of us. Where were we choosing to make new investments and to shift our funding to give us the place and space to do things differently, like standing up warm lines for families and mandators to seek, mandated reporters to seek support before they call to the hotline, reaching across, and we know, right, partnerships are everything. They are hard. They take a tremendous amount of work, but again, reaching across the aisle to other sister state agencies and helping them be accountable to prevention. So working on developing a guaranteed cash income pilot that I know many states are working on, reaching across to our state education department, having access to over 700 school districts, right? And working together to create a joint request for proposals to stand up a very upstream family support model, family centers in communities. We are, New York is not just New York City, it is very rural and right. And we cut across a big swath of geography, many rural parts of the state, using some of our dollars to bring mobile vans with parent partners, with family partners, with bags of groceries, with gift cards, right, to help families who really often, it is poverty, as we all know, that drives us to the system. So, and importantly, I saw someone in the chat mention Medicaid. I don't know that anyone understood when Family First passed, that the iterative generations of Medicaid and the 1115 waivers, the creativity that is now being brought to what Medicaid will pay for to help many of our families in ways that child welfare we never knew about, right? We represent such a small part of their system. Working with our substance use disorder state agency, looking at harm reduction approaches for families who are further harmed when they touch the child welfare system, when they give birth to their child. So I think we took a slightly different approach and have, again, taken full advantage of some of the models in the clearinghouse. I will echo everything that other speakers have said before, that the cost and the level of effort that it takes to implement these models and to bring fidelity. You think about converting that into cash and giving cash support to families and young people's, like, I think those are the kinds of conversations we want and should be having as we're learning about the research Chapin Hall and others are doing about the power of concrete economic supports and how we can really use that, hopefully over time, to re-engage with Congress and of course with our partners at the Children's Bureau, to bring that research and science in modernizing how we approach our child welfare prevention program. So I'm going to stop there. I want to make sure we have plenty of time to hear from Sixto. So Meg, I'll let you introduce him.
Thank you so much, Sheila, and really appreciate your leadership and making the time. And now I'm going to turn it over to Sixto Cancel, who, like I said before, is the founder and CEO of Think of Us. And Think of Us is a research and design lab driving systematic change in child welfare through focused projects and sweeping initiatives. Think of Us drives structural changes in child welfare policies and decisions. And I personally admire Sixto so much, so I'm excited to have him on the webinar today. So I am going to turn it over to you. The floor is yours.
Hello, everyone. Thank you so much. And it's so exciting to be here and so excited to see some familiar faces and some new faces. I think when I think about the reflection, I just got to stop and pause for a second. And although this is supposed to be like a 5-year reflection of Family First, to me, I feel like we've had so little time to actually do that work, right? I have to name that, when I look at the past 5 years, folks have had to do this work in the midst of a pandemic that really took a toll. There are colleagues today that are not sitting next to us in our desk in our offices because unfortunately, they did not survive past the pandemic. There are a lot of agencies and states who have vacancies because folks, have transitioned from those positions. And so I just want to name that the work that's being done, it feels so extraordinary to me because when I think about how is it that folks are pushing on the innovation and folks are pushing through, this is being done in spite of a lot of barriers, way beyond just what we may have identified in this conversation around the actual tactical pieces. And just wanted to start off by acknowledging the resilience of states and tribes and folks who have been doing this work there. So I think for me, when I think about the things that I've heard today, I couldn't agree more that what we have is the beginning of the first step here. And I think what we're missing is a bit more evidence to act that is coming from actual folks with lived experience who are impacted by these systems. And I know I typically say lived experience, folks might be thinking of transition age youth, but I mean that in the broadest sense of those who are impacted by the system and interacting. And we have offered, as mentioned on this panel, a slew of services that are available. We have created a process where folks have to engage with this thing called the clearinghouse, right? And so forth. But I think when I step back, one of the things that we see from doing our direct service, serving 3,000 folks across kin families and transition age youth, is that what's being offered sometimes doesn't align with the intervention that's needed before there's a critical moment of crisis. And so I'll just echo, and I won't spend too much time there, but I'll just double tap on that piece there. And so the way I've been thinking very much about these things is we really do need more proximity at scale. How do we understand, a couple thousand folks' experiences and understand what is it that they needed? And some of that data exists in applications, open-ended forms, to be able to understand what is the collective struggle, the collective need that people across county lines, across state lines are experiencing, and how might we then innovate around those things? And so those are, to me, the evidence to act. And then how do we have enough evidence of progress, right? How do we know we are having an effect that this just doesn't reduce enough chronicness, that doesn't put you in the child welfare system, but that truly is changing the trajectory of your life? And I would say, what is the evidence of impact? And I think that was the intent when we think about things like the clearinghouse, when we think about things like evidence-based programs. But I do believe there's so much more that families need besides the things that have been identified. And we've heard that loud and clear from states and from folks on the ground. But what I'm excited about is that there is momentum for people to push forward. And I thought I would just share some of the exciting things that we're digging into and learning. And it takes me to Indiana. We were able, with a group of folks, to be on site to kind of learn a bit about their prevention programs. And although they're not yet drawing down some of the dollars, to my knowledge, and have submitted their plan and it's been approved, but one of the prevention programs that we were able to see was that they were able to go ahead and restructure the way that they engage with the community providers. I think in the chat, you'll see there's quite a bit of folks who have named the importance of those community providers, and that they said, look, community provider, you are responsible for providing support to this family. Instead of a hourly reimbursement, we're going to give you a per diem. Then we're going to have a data dashboard. We're going to know on a monthly basis how you're serving each of these families. And most importantly, you're going to have flexibility to solve the problem. So if this family needs a therapist that's coming to that home, so that they don't end up in the system, you can help them get on Medicaid and find a therapist. You can hire a therapist in-house. You can have a therapist volunteer. But the point is, you're responsible for getting that need done. And that type of flexibility, that type of financing, that type of contract, and the type of data visibility into what's happening with families across the different social, the SOGI factors, et cetera, demographic and ethnicity, that's the type of, I feel like, structure and innovation that allows for families to get their needs met. And how is it that we're able to actually dig into those pieces there? So what I'm excited about is that we see examples bubbling up of people doing very innovative things. And the question becomes like, how is it that this this law and these regulations can support those type of innovations to do even more? And so I'll conclude by saying where I believe the field is at is like, we have the right vision around, hey, there are things that we can do before we have to separate a family. And I think the evidence for that has grown stronger and stronger. And now us as a public and us as a sector are getting there too. And let's just be real, not everyone shares that sentiment, and we got work to do still, right? Number two, I believe folks are willing to take the daring risk to do it. There's been enough people who have started to innovate with their state dollars, with private philanthropy, and there are states who have leaned into being able to experiment in this way. And I'll say that the combination of prevention, and I'm going to throw in kin, as those of you who know me, and the combination of the leaning towards kin, I think it actually is the setup for actually what transformation for our system can look like. When I think of the smartphone and I think of the flip phone, when the smartphone was being created, the question wasn't how do we build a better flip phone, because we would have got a better flip phone. And those of you who remember, like we had sidekicks, we had all types of different phones that were being created, right? But the smartphone was about adding a value that the flip phone didn't. It was about connecting people more than ever before through apps, through the internet, right? It gave something that was different. And what prevention in this very moment and what kinship provides is the opportunity, in my opinion, to provide such a different value that it's worth leaning in. And it's worth leaning in, not in a way that we say, oh, we've kept X amount of kids out of the system. I believe that's the wrong conversation. It's about, hey, we served X amount of families, and because of the services that we have been able to stand up in conjunction with other agencies, that we have now changed the trajectory of those families and those young people's lives. And so to me, the more that we can lean into that specific conversation, the more that we can go ahead and lean into the type of cross-agency partnerships that is going to be required to actually solve very, 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 very complicated problems, I believe that that's the place we need to go. And I'll end by saying, again, I would just want to like sit here as we think about the 5-year journey, noting that this, in my opinion, this is just my opinion, not even my org's opinion, I'll say it's mine, that to me is like, have folks have really had, you know, a limited amount of time to be able to do this work, like let's say 2.5 years, if you take out the pandemic and all of the barriers that have been put in here. And I would say that the resilience of what has been created to date is remarkable. And like, how might we lean in to even learn exactly what are those tactics, exactly what are those use cases that should be that learning should be transferring across those state lines.
Thank you. And absolutely so glad that we had you as the finale, because that was wonderful. And I love that comparison to the flip phone. And I want to, now we're going to move into an open discussion. And I want to give the opportunity for Sheila and Sixto to touch a little bit on what we heard the panel touch on equity and the role that Family First plays in equity. And I know you both have done a lot of consideration on what equity looks like within the child welfare system and the broader HHS system when we think about moving as downstream as possible. How could Family First play a role in further advancing equity, and what ways could it be more equitable and it's not hitting the mark there? So that was a really long question. It was like 17 different parts. So let me know if I need to break it down a little bit more, but I want to first give Sheila and Sixto the opportunity to touch on that, and then we'll open up with some more questions for the rest of the panel.
Sixto, we almost have matching colors on today.
I love the coordination.
Yeah. Sixto, why don't you go ahead?
Okay. I was trying to behave today, but now he kind of asked the question that I can't stray away from. You know, when I think about Family First, the reality is like, to me, the presence and the power dynamics of a clearinghouse, and I'm not talking about the organization, I'm talking about the structure of the clearinghouse and what it has allowed actually is one of the foundational bricks to cause inequity. Right? When we think about equity and we think about what does that approach look like on the ground for that person who is frontline working with a family, An equitable response to the situation would be one where that worker, that frontline person would be able to work with that family and get them what they need, not offer what they have. And when we think about what do you have to offer, well, it's what's been able to be put into the clearinghouse and get that evidence-based stamp. And here's what's problematic about that. What's problematic about that is that when we think about what are the solutions that make it there, it's not so it's organizations who have been either fortunate someone's paid for that evaluation, or it's organizations who can afford to pay for that evaluation, right? And so when we think about who is serving families and young people and, you know, suburban, small towns and rural areas, those are not the nonprofits that we typically see that are going to be able to cut that check. I remember being in a meeting. And in this meeting, the point was I was with all of these different universities, and folks kept talking about which one of the evidence-based practices traveled well to people of color. And the fact that we have to have a conversation about which evidence-based programs travel, have an effectiveness on children and families of color is problematic in the first place. Secondly, that they have to do more steps to then figure out how to serve people of color. So that means now you got to spend more money to be able to do that. And the last thing I'll say is that 4% of all philanthropic dollars go to leaders of color. If we expect proximate solutions to the people, then first of all, we have a problem in philanthropy where, you know, funds are not going to those leaders of colors. And then folks who are in those positions, you know, leaders of colors tend to, and this is research and I can send this around later, folks who are getting funded who are leaders of color or who are proximate, right? They tend to be paid for a result. And that result ain't the same price point that other leaders have experienced. And again, these are not opinions. This is where this is based on research out of New Profit. And so when I think about where does the inequity start in this, again, it's not the organization I'm talking about. It is the power dynamics of a clearinghouse that has prescribed what is and what is not reimbursable, and then states having to choose from a limited pool there.
Thank you. And I've seen many agreements in the chat and really thinking through the role of evidence. And I love how you framed as the institution itself and not just talking about the inequitable access of programs. So really appreciate that. And Sheila.
Yeah, I would say just really three things come to mind, and certainly agree with everything Sixto said so eloquently. You know, and I'm talking about, you know, big prevention, not just limited to family first. But, you know, when you talk about equity, I think about access, and that has a couple of different dimensions, right? It's touching upon, you know, what is needed by a family, and how do we allow them to access it without meeting so many eligibility thresholds and having to prove that they are, you know, that they are deserving of receiving services. There's something very perverse about the way that we have structured equity of access to begin with all of these very cumbersome eligibility and sort of proof of worthiness standards. And I think that there's a lot to be diving into there. And then I think the services themselves, which everyone has talked about, and the point I want to make about that, and these, you know, conversations that we were having back in New York, and, you know, we're having them at APHSA, and it is about where do our child welfare dollars go? You know, right, when we procure government services, because it's so complicated, it is so bureaucratic, it is so legalistic, right, that we eliminate so many not-for-profits, hyper-local, right, communities that are trusted, that have capacity to provide services. They cannot compete in a government environment. And I think we have to really take a hard look at how do we create space and place for those in communities, right, that families will trust, that it is not the white, large, mega, not-for-profit agency who's got 76 satellite offices, right, most of which are not in the actual community, you know, that are being served. And those are some really hard conversations to be had, but I think it's very important. And then, of course, the workforce and the complexion and diversity of our child welfare workforce. There are certainly places in New York where, you think of New York City, very diverse, workforce outside of New York City, not so much, right? And so how do we continue to create opportunities through our training and workforce? I think the workforce crisis should be, if it's not already, creates all new conversations about who is worthy and who should be doing the work in our child welfare spaces.
Yeah, thank you, Sheila. And that's reminding me of conversations I've been in recently about creating shared power and what that means. And so important to think about what that means intentionally in prevention services and family first. So we have time for one or two other questions, and I'm going to open this up to the rest of the speakers. So please, to our panelists, raise your hand if you would like to answer this. If nobody raises their hands or volunteer, I will pick someone. So we'll play roulette with it. But I'm going to start here with a question that we got from one of the participants. What risks and solutions do you see to the risk of increased surveillance by the expansion of prevention services that are connected specifically to child welfare agencies? And I know this one is a lot to consider, and I know we might need a second to think about it. And Jerry, I saw put yourself on camera, which is basically volunteering as tribute. So I wanted to see if you wanted to kick us off.
Well, I'll get on a little bit of a roll here. I think, you know, we're talking about family first and prevention, but there's another huge set of issues going on in child welfare right now around mandatory reporting. Frankly, because we see so many overrepresented groups in child welfare, also overrepresented among the ranks of the poor in this country, they become much more visible. And many more contacts with mandatory reporters who then end up reporting them, not because they're abusing or neglecting their children, but because they are vulnerable and they are in vulnerable circumstances, and because mandatory reporting doesn't know anything else to do, and because we threaten them within an inch of their lives if they don't report. And I think we have to remember when we're saying that the services that we're going to pay for, they're going to be provided by mandatory reporters. So if these are your only options, these are the only things that we're paying for, we're sending people to the very people out there who may not have another option and may just err on the side of protecting themselves and end up reporting. I think it's that kind of thing that promotes over surveillance of families and makes them much more at risk of becoming entangled in the child welfare system. A mother, you know, not too long ago said to me, you know, all I needed was a little help, and they took my kids away. And you know, it's an absolutely true story. And I don't think there's anything in Family First that discourages that, quite honestly.
Thank you, Jerry. And a definite reminder that, you know, Family First is one part of advancing other systemic structural issues that exist in the health and human services, and particularly in child welfare. And thank you for that. And I'm going to stay on this question and ask for one other response. So raise your hand or come off you. 6-2, you got it.
One of the things I struggle with all the time is the trade-off of time and the trade-off of where to focus, right? And when I think about, you know, how do we lean in this particular moment? To me, it's like so problematic that we're like, hey, we got to stop mandatory reporting because like our system is going to do so much harm. And so when I think about where's the point of leverage that we change, you know, those reports are coming in from police. They're coming in from hospitals, they're coming in from schools. That's some of the top places that are coming in, right? And so to me, I'm like, are we trying to like dig into 3 different, you know, systems to try to get them to act differently? How is it that, you know, what we can control, we start to actually address? And so like, what does that look like? And it's hard because I'm not saying, and I'm not arguing, let me be very clear, for one solution or the other. But I am highlighting that there is an exercise that I feel like as a sector and as like a collective impact kind of approach should be like, where do we put our energies? Because to spread us thin across the many different components that pipeline families into us, it feels overwhelming. And so to me, I'm like, how does Family First and the implementation of this legislation actually say, where's the focal point that we can go ahead and leverage its financing, its rules, and additional regulations to say, here's how we can do the most good with what we're designing in that container in.
Thank you. And
It's
you
not a
actually,
popular statement, but I'll just say that that's been some of the things I'm struggling with.
no, it's important to have those conversations, and those are things that we're all considering the layers and complexities that exist both within child welfare and the greater system that it experiences that exists in. There we go. That's the word I was looking for. Well, that brings us right up at time, and I want to thank all of our speakers today and those who have joined in the audience. We will follow up with both the recording and some additional information. This is the first of a series of webinars that APHSA and Prevent Child Abuse America will be doing, reflecting on Family First at the 5-year mark. The next one will be on funding prevention services, financing strategies and challenges. And this one will be closed to state and local health and human services and other invited stakeholders. But wanted to note that other ones will be open to a wider staff or wider audience, but that one will be closed for a state and local specific conversation. So thank you all. I appreciate everyone's time. I was inspired by this conversation. I want to thank again my colleagues at Prevent Child Abuse America that helped me pull together this webinar, Jennifer Jones, Kelly Crane, Lynn, I'm forgetting your last name, Lynn, and I'm so sorry, but wanted to thank you. And of course, Matt Lyons and Dr. Merrick for their time and their leadership. Thank you again to our panelists, and we look forward to continuing this conversation. Thank you so much.